Hi everyone. Today I want to talk about something a lot of people our generation do not think about when they hear the word addiction. Most of us picture substance use itself, but we rarely think about the emotional pain underneath it. The reality is that trauma plays a major role in why so many individuals struggle with addiction. If we want to understand what people are dealing with, we have to look at the cause behind the behavior. In The Search for Oblivion, Gabor Mate explains that many people turn to substances to cope with painful memories, anxiety, or emotional suffering. He argues that addiction is not a choice, but an attempt to escape deep human pain. For many people, trauma is the main force behind their substance use. When someone stops using, these negative feelings often come back, which makes early recovery extremely difficult and increases the risk of relapse. This helps us understand addiction from a logical perspective. This matters for us as students because trauma is a lot more common than people admit. Almost everyone knows someone who has dealt with something serious in their past. When you imagine someone trying to keep up with school while carrying that kind of emotional weight, it makes sense why they might use substances as a way to cope. Understanding this makes it easier for us to respond with empathy instead of judgment. With just a bit of training, the medical students in the Goldstein study said they felt more confident noticing trauma and responding in a supportive way. They learned how to ask safe questions and guide people toward the right resources. The study also showed that without this kind of training, professionals often struggle to give the care trauma affected people need. This makes trauma informed approaches even more convincing. So, what can we do as students? First, we can stop judging people who struggle with addiction and recognize that trauma may be the real issue behind their behavior. Second, we can support trauma informed approaches on our campuses by promoting mental health resources and safer spaces. Finally, we can educate ourselves about how trauma affects behavior and mental health so we are better prepared to help friends or classmates who might be going through something. If we want real change, it starts by understanding that healing begins when we address the trauma behind addiction, not just the addiction itself.